Welcome to part 2 of skull anatomy. In part 2, we are going to focus on the temporal bone. The right and left temporal bones are very important structures in the cranium because they house the organs of hearing and balance. And as you can see from the drawing, the temporal bone lives in between the sphenoid bone, which is anterior, and the occipital bone, which is posterior. Notice the flat portion of the temporal bone. It is called the squamous portion. And maybe you've noticed a reoccurring theme here in the cranium. Flat portions of bone are called squamous portions. Anterior to the squamous portion is the zygomatic process, and you can see that here. The zygomatic process meets part of the zygomatic bone, which is a facial bone, to form the zygomatic arch. And you can easily palpate the zygomatic arch. It's just anterior to your ear. So here is your external auditory meatus, and here is that zygomatic process which forms the arch. Below or inferior to the zygomatic arch and just in front of the external auditory meatus is the temporomandibular fossa. And that is that half circle shape right here. And that is important because the mandible actually fits into that fossa to form the temporomandibular joint, or the TMJ. Inferior to that TMJ and anterior to the EAM is a little bony projection that I want you to know called the styloid process. And let me point that out right here. Okay, so here is our TMJ joint. Here is our EAM, or our ear hole for lack of a better term, and then our styloid process. Now, before we go to the next slide and talk about a few more things with the temporal bone, I want to point out the mastoid portion. We're going to talk about that on the next slide, but I want you to notice it's directly posterior to the EAM. Okay? Okay. Each temporal bone is divided into 3 primary parts. And we've already kind of talked about the first part, the squamous portion. Remember, that is the flat upper lateral part of the temporal bone. This part of the skull is quite thin and is actually the most vulnerable portion of the entire skull for fractures. The second portion of the temporal bone is the mastoid portion. And remember, that is posterior to the EAM. Within the mastoid portion, we have a mastoid process or tip, again, posterior to our ear. Here's our styloid process that we talked about a minute ago. Within the mastoid process, we have many air cells, and we'll look at pictures of this in another lecture, but mastoid air cells are really pretty cool to look at on a CT scan. They actually look like pockets of air. The third portion of the temporal bone, and one that is very important for us for positioning, is the petrous pyramids, or the petrous portion of the temporal bone. And this is located posterior to our orbits. The petrous portion houses the organs of hearing and equilibrium, and it also contains more mastoid air cells. And again, we'll talk about that again later. The upper border or ridge of the pyramid is called the petrous ridge. So here is the dense petrous pyramids. The top of the petrous pyramid is the petrous ridge. Okay, and that's really an important landmark for positioning. So we're going to talk about petrous ridges a lot in lab. This area, again, is located directly behind our orbits, and it's a very dense piece of bone. Okay, let's look at the temporal bones from the top down. So here we have cut the skull transversely, removed the top, and we're looking downward into the skull. The temporal bone is highlighted here in this pinkish purple color. Okay, this is anterior, this is posterior. The pyramid portion of the temporal bone is the thickest and densest bone in the cranium. And the petrous pyramids project anteriorly and towards the midline, beginning at the area of approximately the EAM. So here is the level of our EAM, or our ear, our external auditory meatus, and notice this thick, dense portion, or the pyramids, point anteriorly and towards the midline. And remember, the top of the pyramid is known as the ridge, okay? The petrous ridge corresponds to approximately the level of the TEA, or the top of the ear attachment. So where the top of our ear attaches to our skull, externally, that's approximately the level of the petrous ridges. Couple things I want you to notice. Notice the jugular foramen on the posterior aspect of the petrous ridges, right here. And of course, we have one on both sides. That is where the jugular vein and certain nerves pass through. Also notice the internal acoustic meatus, and that is here, and of course you have one on the other side as well. The internal acoustic meatus serves to transmit certain nerves of hearing and equilibrium. Okay, each temporal bone articulates with 3 other cranial bones. So first, you have a parietal bone. So here's our temporal. So we're articulating with a parietal. The occipital, of course, which is back here. So here's the articulation between the temporal and the occipital. And then, of course, the sphenoid bone, which we haven't talked about yet, but this is the sphenoid. So you can see there's 1, 2, 3 articulations on each side. The temporal bone also articulates with 2 facial bones, and we'll talk about that again in a separate lecture. Okay, we are going to pause part 2 here. We will pick up part 3 talking about the sphenoid bone.